Throughout the winter illness season, many people unfortunately come down with a cold, and some can last for weeks. Susan Wolf, Clinical Director of Digital Care with OSF On Call, joins us to tell us about accessible at-home options for you and your family. Good morning.
Good morning.
Thanks so much for being here with your bright colors and energy to inform us of some really important things. So what telehealth options do OSF have for patients?
Yes, so OSF On Call has several options that I could talk for several minutes with you for, but really what I want to focus on today is our virtual urgent care platform option for telehealth for patients. So this is for patients who have common illnesses, everything we're seeing today. So your common cold and flu-like symptoms, but also even, if you have those UTI symptoms, your back pain, headaches, rashes, pink eye, anything like that, the patient can connect with a provider at any time, 24/7, 365, and there's no appointment needed. That is one of our platforms that is very hot right now. And then we also have other platforms where we have remote patient monitoring. And those programs, the patient can be enrolled in for as little as 10 days, 30 days, more so managing those acute conditions that were recently diagnosed where we can see them through that short course of an illness. Or they can be enrolled in a program for more chronic condition management and monitoring. So that would be, it could be 6 months, it could be even many years. And that's where we're monitoring the patient's hypertension, heart failure, diabetes, and so on.
So how did respiratory illnesses virtual care expand recently, and how's this beneficial for families?
Yes, so we actually started our pediatric RSV program last cold and flu season, so that would have been fall of 22. And we really focused solely on pediatric RSV patients first. And then we kind of debriefed after that and said, let's go ahead this next flu season, which was this fall of 23, and let's expand it to all of our pediatric respiratory illnesses. So yes, we'll still accept those pediatric RSV and bronchiolitis symptoms, but let's go ahead and also see those flu patients, those influenza patients, and so on. And that has proven to be greatly beneficial to families because those pediatric respiratory illnesses, say you get diagnosed on day 1 or 2, really those illnesses peak on day 3 to 5 of that course of illness. So that's when we see the most severity of the symptoms. And what better tool to have in your back pocket than a program where you can connect with somebody, a nurse, a provider, 24/7 with any questions you have about your patient, your baby, your kid, when you see them kind of, struggling to breathe or their coughing is worsening. So
yes,
that is so nice to have that offering.
It definitely is. And where can people find this digital resource?
So they can go to Google, and as easily they can go ahead and Google OSF On Call Virtual Urgent Care or OSF On Call, and you can see all of these programs. If you'd like to start that visit, you just, like I said, Google OSF On Call Virtual Urgent Care, click Start Your Visit, and you'll be connected with the provider very quickly.
All right. That sounds great to us. I know we'll have that information on our website as well, but for now, stay safe and healthy, and thank you for joining us.
Thank you so much.
We'll be right back.